Dr. Gold, when people come to your practice and do an eye exam, overall with people, what have you noticed is something they kind of miss and don't do, like a common mistake with the eye people make, and by doing so endanger themselves in some form or another of having not quite the great vision, or maybe even lose their vision, which is really handicapping life, because not seeing well, basically having a blurry world is just couldn't be good. For instance, I have heard that a tremendous amount of kids are basically called dumb and inattentive and all kinds of things when it only boiled down to that they really couldn't see the damn blackboard, and it took sometimes years and years to find that out for some funny reasons. I'm sure this type of things don't happen as often anymore. Kids have, regulatory examines and all that stuff. But what would you say, people out there, whether it's adults who have kids, what should they do or not do in order to preserve their vision?
Well, it's pretty rare anymore for a kid to grow up with poor vision and nobody find out about it because of the school screening programs that have been in existence for quite some time. Kids can cheat. You put a whole bunch of kids in a room, and some of them are going to memorize what the other kid said, but typically the school screening exams find most of the kids who need glasses. Pediatrician exams, as part of a general physical exam, pediatricians look at the child's eyes and they have them read an eye chart, and that's a good start, but it also can miss some things. So the combined recommendations of the academic associations of ophthalmology and pediatrics have recommended that a child's first exam by an ophthalmologist take place before age 5. Next one before age 10, a couple of times during the teens, every 2 years from 20 to 35, and every 1 year thereafter. In the adults, the biggest thing that can be overlooked if they don't get those exams is the disease called glaucoma, in which the pressure inside the eye builds up sufficiently to damage the nerve of vision, and the person doesn't know it because the vision starts to close in from the outside. They lose their peripheral vision. And unless it's happening in both eyes, the second eye compensates for that until they almost have tunnel vision. They don't realize what they've lost. By that time, it's very, very difficult to stop the process. And it certainly can't be reversed. So periodic glaucoma checks, very, very important. The most important.
Did you just break up, Doctor?
I may have.
Okay.
I finished by saying the most important is periodic glaucoma checkups, depending on your age.
Right, because what you say is the glaucoma, once it is happening, can really not be reversed anymore?
Once there has been visual loss from damaged optic nerve fibers, that can't be reversed. Just having an elevated pressure in the eye, if it's detected before it has caused any damage, can be stopped, usually just with eye drops.
So definitely in this case, an ounce of prevention is worth a pound of cure or something like that, right? Maybe.
More than a pound of cure.
Because it's infinitive. Once you lost it, you cannot get it back. So, but while you catch it relatively fast, early, it can be prevented or stopped at least. At whatever level it is. And what would you say is for an average adult the time frame to make sure that it didn't get too far?
Between the years of 20 and 35, every 2 years is sufficient. After 35, every 1 year.
Got it. Okay.
With an ophthalmologist.
With an ophthalmologist. Well, since you bring that word up, with an ophthalmologist, so would you say that if a person goes and does his examination with an optometrist, that the optometrist might not look at all these things? Because as far as I know, most optometrists do look at glaucoma, cataracts, and they do those examinations. So they say, at least. I am not, I'm not from that field. What would you?
They do. You're correct. Optometrists look at everything.
Okay.
As far as glaucoma is concerned, the big difference I find between optometrists and ophthalmologists is ophthalmologists can be more specific about the exam and not do unnecessary testing. And I find in some optometry practices, every test they own, they'll do on every patient, whether it's warranted or not.
Got it. Well, all right. So anyway, basically testing. Are there any symptoms, like let's just say a person runs around in the world living, doing things, any things a person should be aware of, that if there's a certain symptom, a certain, thing happening to him, to his eyes, to whatever, that he goes, something may be going on, I better check it?
Well, there are three things that we consider ophthalmologic emergencies. One is loss of vision, second is redness of the eye or eyes, and the third is pain. If somebody were to call my office with any one of those three things, they would be told to come in instantaneously.
Okay.
Then there are other things which bother people on a more chronic nature that more typically are related to dry eye, and that's burning, grittiness, feeling of dryness in the eye. Many people out there have dryness of their eyes without realizing that that's what's bothering them. They say, oh, it's just eye strain, I maybe need glasses, but more often than not, we find dry eye in people who previously didn't suspect that their eyes were dry.
Got it. Okay. Well, all right. What about, let's just say, people who work a lot on a computer, which is today a very big thing, So, is there anything they should pay attention to? And, some eye exercises maybe? Do you find that having a decent eye nutrition, like I think lutein and vitamin A and that type of stuff, does it actually have much of a bearing? Does it help the eye to stay healthier? What do you think? What's your feeling on that?
Well, the eye requires vitamin A for the retina to function and for the tear production to be adequate. Vitamin A is required, but you can get enough vitamin A from a carrot once a year.
From a carrot once a year?
Yeah, so you don't really have to worry about that. As far as lutein is concerned, there's never been any proof that lutein will help or prevent macular degeneration, and that's the fear. But there are some indicators that antioxidants, such as found in omega-3s from fish oil or flaxseed oil, for example, that those can be helpful, preventive in terms of macular degeneration. So I advise my patients to eat plenty of green leafy vegetables to get antioxidants. The people who actually have dry eye, I ask them to take omega-3s in the form of capsules. And there's fish oil, there's flaxseed oil, there's a whole bunch out there. As far as eye exercises, you brought that up. There's really no such thing as an eye exercise. It really doesn't do anything, although there are entire groups of doctors out there who call themselves developmental doctors, and it's really a sham. It's been disproven time and time again.
That's a shame because I fell for it. Because when they said you must move and exercise your eyes, ever since I heard about that, I always started looking at the pretty girls from my other side here. And you're telling me that doesn't work? It was rather pleasant.
There are definite benefits to looking at attractive women.
Oh, okay.
It has nothing to do with your eyes.
Oh, okay. Well, as long as there's some benefit, we're all right, I guess. I got it. Now, look, you mentioned the word, because of, like, in terms of the omega-3 and all that, and perhaps because of the antioxidant value of those things, flaxseed and all that, about macular degeneration. Explain just in a, we have another minute here. Explain, what does macular degeneration, not so much from a clinical viewpoint, but from a, how do I know that I might have macular degeneration? What does it do to me? What is macular degeneration?
The earliest symptom, in fact, the macula is the part of the retina that allows you to see fine objects. Mm-hmm. And the first symptom is a distortion of the vision of whatever it is you're looking at. Like lines will appear crooked. And late onset macular degeneration, later in its course, there's actually a disappeared spot in the center of your vision, a hole in the vision, if you will. It represents a lack of circulation in that part of the retina called the macula. And if it's found early, it can probably be slowed down with antioxidants. And there's a lot of new technology out there in the form of a combination of injectable medicine and laser treatment to treat wet macular degeneration. That is caused by leaky blood vessels in that area of the retina. Dry macular degeneration needs to be detected early enough that things like antioxidants can be used to really try to slow it down.
Great. So
that's one of those things that is detected with an annual exam in adults.
Mm-hmm. And macular degeneration, kind of like the line becoming crooked in the center, right? And then finally, literally, kind of like you're getting a hole, it disappears. So that's not the same than having a blurry vision, which then get fixed with LASIK.
Completely different.
Completely different. Okay. So rather than taking antioxidant, what is the treatment for macular degeneration?
There's no real treatment. The attempt to slow it down using antioxidants has been tried for years, and there's some evidence that it's successful. If you have the other kind, the wet kind, laser treatment with certain medicines injected before the laser treatment can stop it but not reverse it.
Got it. So at whatever level you reached it, you can stop, which is already not a bad thing to a very high degree, right? I mean,
right.
So wonderful. Well, again, I appreciate your candidness. We're definitely learning a lot here, and we kind of like, get this, the relationships, the difference, because it's it's a complicated topic. There's so many little illnesses in such a small little place, and each one does something a little different and gets treated a little different. And at least me, I don't know about other people, I confuse one with the other one all the time. So I appreciate you explaining it to me. Maybe I keep it one of these days and actually start remembering. Thank you.